Good morning, and thank you for joining us for another Ministry of Health virtual media conference on the COVID-19 response. Our panelists today are the Honorable Terence Singh, Minister of Health, Dr. Miriam Abdulrichards, Principal Medical Officer, Institutions, and Mr. Davlin Thomas, CEO of the North Central Regional Health Authority. I am Al Alexander, Senior Corporate Communications Officer in the Ministry of Health, and your moderator for this morning's media conference. We certainly have a packed agenda this morning, so without further ado, I invite Dr. Abdulrichards to present the clinical and parallel health care update.
Good morning. Thank you very much, Al, Honourable Minister, my colleague, Mr. Davlin Thomas. Good morning to all members of the media who have tuned in and continue to participate in our media conferences. Good morning, Trinidad and Tobago. Thank you very much for your continued attendance and participation in the Ministry of Health's press conferences. This morning, my presentation will be two-part, the customary update on the media release as of the 20th of November 2021, that is media release 922, and a brief summary of the status of the hospitals in the parallel healthcare system. Before I start, I'd just like to commend and recognize all our healthcare workers and others who continue to work and provide selfless national service. And my colleague, Mr. Thomas, and the Honourable Minister will provide further information on their status. So I'll now move on to the media release 922, dated the 20th of November 2021, and this information is as of 4 p.m. yesterday. An additional 456 positive cases were reported. This has now taken the rolling average up to 607, and as Dr. Hines continues to indicate, this has been progressively increasing. The additional new positive cases takes the total number of active positive cases to 10,477, and these cases are divided as follows. 9,304 of these persons are in home self-isolation, 174 are in step-down facilities, and 543 persons are in hospital. At present, the total positive cases for COVID-19 from 12th March 2020 to present is 70,136, with 5,573 persons being totally recovered. Unfortunately, 25 persons succumbed to the COVID-19 virus yesterday, and this takes the total number of deaths to 2,115. We extend our sincere condolences to the relatives, friends, family, and associates of the recently deceased. This again underscores the need for all persons to please be vaccinated as a means of saving lives. I'd like to now move on to a brief summary of the parallel healthcare system, and I'll start by indicating and stressing, as on the media release, that 90.9%, that is 5,726 of the 6,302 persons in the parallel healthcare system from July 22nd to November 10, 2021, 90.9% of them are not fully vaccinated. As of this morning, we continue for the 42nd day with consistent trends, and our overall occupancy across Trinidad and Tobago is 70%. The parallel healthcare system, if we broke it down between Trinidad, 73%, and Tobago, 47%. And I'd just like to reiterate that the 75% marker is what we look at as a critical threshold, and it demonstrates that we continue to see increasing numbers of severely and critically ill persons presenting into the accident and emergency units. This morning, there are 90 persons who are receiving care in the accident and emergency departments in our traditional RHAs, of which 21 are receiving ICU-level care because they are too unstable in many cases to be transferred to the hospitals in the parallel healthcare system. Of the 21 persons receiving ICU-level care, none of them are fully vaccinated. So just to reiterate, 21 persons in receipt of ICU-level care at our traditional RHA A&Es, and none of them being fully vaccinated. This has been a consistent trend that we have noticed for the past 42 days, and on any given day, anywhere between 11 and 44% of persons at our A&E require ICU care, which of course is resource intensive. Another trend that the clinicians have been reporting daily on continues to be persons presenting in a severely and critically ill state. The GMRTT service continues to document refusals despite the fact that persons are requiring hospital-level care, and we continue to see a preponderance of persons who are not fully vaccinated requiring clinical care. In our ICUs in the parallel healthcare system, this morning there are 57 patients out of 72 available beds in Trinidad, and of those persons, 47 of the 57 are not fully vaccinated. So again, a consistent trend. In Tobago, there are 4 patients. None of the 4 patients are fully vaccinated out of an available 9 beds. The Ministry of Health continues to do all in our part on a phase basis to increase the number of ICU beds and high acuity beds based on the current demands that we have been noting clinically. And we have been gradually increasing, despite limitations in human resources and other resources, to increase the number of beds. We've been trying 1 bed a day at a hospital, 2 beds sometimes, ramping up even in the accident and emergency departments. Today we stand with 27 ICU-level beds in our traditional A&Es with staffing to support them. And at present, and again, it's a dynamic situation, 72 in Trinidad and 9 in Tobago in the parallel healthcare system. We are trying our utmost best. But on behalf of all of my colleagues and on behalf of everyone who you've seen here and has spoken to you via these press conferences, we continue to appeal to you to please get vaccinated. Please don't delay, get vaccinated today. It's your only chance at this point of preventing yourself or your loved one from being admitted into an ICU facility. Thank you very much.
Thank you, Dr. Abdulrichards. We now welcome back Mr. Davlin Thomas to share with us the latest vaccination figures from his region and what resources the NCRHA has in place to treat with the current increase in COVID-19 cases. Mr. Thomas.
The Honorable Mr. Terence Yalsingh, Minister of Health, Dr. Miriam Abdulrichards, Principal Medical Officer, Mr. Al Alexander, Senior Corporate Communications Practitioner at the Ministry of Health. The highlights for COVID-19 vaccination sites are they are provided at the following sites: Arima Health Facility, Blanchisseuse Health Center, La Hoqueta Health Center, Maloney Health Center, San Rafael Health Center, Talparo Health Center, Chaguanas District Health Facility, Cunupia Health Center, St. Helena Health Center, Aruca Health Center, Macoya Health Center, St. Joseph Enhanced Health Center, and the Tacarigua Health Center. Our mass vaccination sites include the Larry Gomes Stadium, the UTT Center facility at Monroe Road, the Wallerfield Raceway, a drive-through facility, and the Costat Eldorado campus. We've had outreach arrangements facilitated within the community. Some of the highlights are at the Farmers Market, the Lopino Bonaire West, the Trinity Mall, Courts, at Courts, Freeport, Massey Stores Limited, the Extra Foods in Arima, and Price Mart, Chaguanas, to name a few. Some of the other highlights where we targeted organizations included Field, Angostura Limited, the Market Vendors Association, the Pennywise Employees, Chamber of Commerce, etc. The NCRHA, somewhere in 3 years ago, we would have initiated an incident response team. As you are aware, as the Minister would have indicated earlier, later last week, we've engaged the EOC and activated the EOC. And we've done training with Falk International and prepared to go. We're responding in 3 phases: the gray zone, which is when the institution reaches its full capacity in terms of equipment, human resource, and infrastructure. And blue zone, when we start to engage novel practices to facilitate additional patient loads. And of course, red zone, when it's approaching more difficult situations. The role of the PHO at the NCRHA, which is the Public Health Observatory, facilitates projections which provide us with the adequacy to match supplies and oxygen, consumables, reagents, etc., for future demands, as well as our personal protective equipment for staff to alleviate stockouts. It also facilitates us readying ourselves for future tiers of readiness, as described earlier, gray, blue, and red, as required for further action. Our total vaccinations thus far at the NCRHA would have been, to date, 283,741. Total vaccinations thus far. It's 200 vaccination doses thus far, 283,741. We are continuing with our Elderly Express experience, which is a highly personalized premium VIP experience for the elderly. The numbers of elderly persons within our catchment area that we've vaccinated are 1,359 at homes and at the homes for the elderly. We continue to applaud our staff for their commitment to the people of this country and their resilience. The NCRHA launched the NCRHA's preview app for those persons who have been sent in isolation or quarantine. Currently, we have at least 263 persons daily logging into the apps to indicate what their SpO2 are. Those persons are continuously monitored by doctors and are being called when necessary and moved within the community. The app has the ability as well to identify location if necessary. We urge that persons who are sent on quarantine and have an SpO2 monitor utilize that monitor to facilitate the input of that on the app. Our training highlights include, and we've done considerable training to build resilience within the system, particularly emergency care training with level 1s, 2, and 3. Level 1 is for patient escorts, patient care assistants, etc. We've trained 296 of those personnel in emergency care. We've also trained, and specific to COVID-19, we've also trained a further 312 registered nurses and house officers and primary care practitioners in emergency care regarding COVID. And in level 3, we've trained the higher tier of registrars, particularly within primary care, for readiness in a worst case scenario. We've also trained 399 persons in guidelines for the management of COVID-19 patients on wards, and also trained 249 persons in the management of recovered COVID-19 patients with pulmonary complications. In addition to that, our infection control, prevention and control is robust. We've trained 4,800 persons in infection control and prevention. We've also trained 778 persons in basic life support, and we're talking about RNs, retraining, and of course our patient escorts, hospital attendants, PCAs, psychological support and mental health awareness. We've trained 902 persons to continuously build and maintain psychological and psychosocial resilience within the system. We've also we have an ongoing webinar in which 660 members of staff would have participated, and this is being championed by our head of psychiatric services, Professor Hutchinson. We've also had vaccine sensitization sessions for 771 persons. Thank you all.
Thank you very much, CEO Thomas. I now hand you over to Minister Singh for the latest vaccination figures and an update on issues pertaining to the national COVID-19 response.
Thank you very much, Al. Good morning to Dr. Richards, Principal Medical Officer Institutions. Good morning to Davlin Thomas, CEO of North Central RHA, and Mr. Thomas, on behalf of all the persons within your RHA, I want to thank you for the wonderful job you and your team have been doing. I think you manage the bulk of the COVID facilities at Cora, at Cuva and Arima, and all the other CEOs and their teams who have been doing a wonderful job in this response. Thank you very much on behalf of a very grateful nation. The vaccination update figures will go like this up to the close of play last night. First dose, 643,911. That is 46% of the population with their first shots. Second shots, or fully vaccinated, combination of a second shot of a two-dose regime or one shot of a one-dose regime, 642,105 persons. That is roughly 46% of the population. So we have cracked that little 46% mark, still not good enough. And I will come to that in a short while. The number of persons accessing the additional doses so far, 22,010. Before I get into my major announcement today, I want to alert the national community and plead with our political opponents that one of the hallmarks of countries that do well in their COVID response is putting partisan politics aside. In a global pandemic, countries that have done well, one of the ingredients is political solidarity. Where you have voices continually engaging in ad hominem attacks against individuals, personal attacks against our healthcare professionals, and no matter how reasonable people in society push back against this, the opposition in Trinidad and Tobago, unfortunately, wants the government to fail in its COVID response so that they could use that failure as a political vehicle to get back into office. I continue to be both disappointed and disgusted by Dr. Tim Gopisingh, who is an obstetrician and gynecologist, heaping scorn on Dr. Roshan Parasram as a public health expert. Dr. Parasram is a public health expert, not Dr. Gopisingh. If Dr. Parasram was not recognized as a public health expert, he would not have been given an honorary doctorate by the University of the West Indies. He would not have been named Individual of the Year by the Express last year. These personal attacks, which is now common with the UNC, whether it's against high office holders, is something that needs to be tempered and obliterated from our personal landscape. Dr. Gopisingh, when he had COVID, benefited. He owes his life He owes his life to the policies developed by Dr. Parasram, Dr. Michelle Trotman, Dr. Mariam Richards, and Dr. Avery Hines. But once recovered, these same doctors to whom he owes his life, he now finds that it is politically convenient to attack them at every possible turn. And it is an unfortunate development in our local landscape. If there's one thing that we need to put aside our political swords for, is this fight. I ask that the right-thinking citizens of Trinidad and Tobago condemn Dr. Gopi Singh and his political leader for continuing this attack. And I want to remind the country, it was the same Dr. Tim Gopi Singh when he was a member of parliament, when the Honorable Kamla Prasad Visesa led a team to meet with Prime Minister Dr. Keith Rowley. It was Dr. Tim Gopi Singh. His response to COVID as an obstetrician and gynecologist was hydroxychloroquine. I want the country to understand that and remember that. Their response was hydroxychloroquine. Their response in the Senate was punching and lime. Remember that. And their response in the elections last year was to build a dome over Trinidad and Tobago. Ladies and gentlemen, this is a time that calls for leadership, not only from the government, but from all of us who have the potential to influence people who look to us for leadership. So I am again disturbed that a man like Dr. Tim Gopi Singh could lose his ethical and moral moorings, and I will continue to protect the healthcare workers of Trinidad and Tobago. I will continue to protect them and defend them against these personal attacks. They are doing everything to shake confidence in the healthcare response to COVID and the vaccination drive. Ignore them, ignore them, ignore them. Ladies and gentlemen, this is a time where we have the new Omicron variant, not for fear, not for panic, but now is a time for vigilance. If I could leave the country with one word today, with one theme, with one message, is that for vigilance, not necessarily fear and panic. Trinidad and Tobago is in a very fortunate position now in having a stock of over 690,000 vaccines in Trinidad and Tobago, 690,625. In the early days when policies for vaccinations were being developed around the world, it was a time of severe vaccine inequity. The term vaccine apartheid was being coined by other commentators abroad. And a lot of the vaccination rollout programs were based on this issue of vaccine inequity, and that we shouldn't do certain things because other countries don't have vaccines. And we were in that position at one point in time. Knowing after 2 years that this COVID virus and our response to it is going to be ever evolving, especially when variants of concern started to rear their heads, alpha, beta, gamma, delta. If Trinidad and Tobago, like all other countries, didn't learn from the experiences and our current experience with delta, if we didn't learn and engage in scenario planning for the future, that would have been not a very good place to be. We engaged in some scenario planning. And part of that scenario planning was building up a strategic stock of vaccines. which is in excess of what we normally will use. Now that the new variant has come to pass, it is now time to revisit our vaccination program, because we have acquired in the past 2 weeks over 234,000 doses of vaccines. And you might ask yourself, why did we acquire those if only 1,000 to 1,200 persons a day are being vaccinated? We acquired those vaccines because we determined we had to be very proactive, because this virus throws up surprises every single day. So Saturday, gone, the 27th, I believe, we got in a shipment of 84,000 Sinopharm vaccines to the COVAX facility. 2 weeks prior to that, we got in 150,000 doses of J&J vaccines from the African Medicine Supply platform. So that 234,000 doses of vaccines brought our stocks up to 690,625, which is far in excess of our current needs based on current usage. But that was not the only driving factor. The other driving factor was that we knew at some point in time that if we didn't proactively do this, and we want to keep on protecting our vaccinated population outside of the current program, we were going to have to launch a booster program. I can tell you that that discussion has been happening at the Ministry of Health for the past 2 to 3 weeks. And now that vaccine inequity is no longer an issue, now that we have the strategic stock of vaccines, now that the Omicron variant, which you expect different variants, we just can't predict what the variant is going to be like. We will be coming to the public very soon with our booster program for the 642,105 persons who are already vaccinated. That is why we have been quietly building up a strategic stock, knowing that at some point in time we have to go to a booster program. So we will be making further announcements in the coming days, hopefully days and not weeks, as to where we are with the booster program. But I'm alerting the country now to allay the fears of all those persons who are desirous, regardless of your disease state or age, that in fact a booster program is coming. It is being actively considered and discussed at the level of the Ministry of Health. And as soon as we have operational details, we will come to you. In the interim, I have instructed the RHAs to get more aggressive with the current additional dose program, especially for those over 60 with Sinopharm, which is by far the most popular and widely used vaccine. So all those over 60, regardless of your disease state, the RHAs, each RHA will be communicating. We want to do away with this system of calling you now, because we have already covered 22,000 persons across the categories. To speed that up, we want to speed that up. So the RHAs will be putting out their communiques under my instructions as of this morning, that we are going to be speeding up, especially the over 60s who receive Sinopharm, which is the bulk of the over 60s. They got Sinopharm. The bulk of the population got Sinopharm. And that is one of the reasons we accepted another 84,000 doses of Sinopharm. Without the need for an additional shot, whether it's via a booster program or the current program, it may have been superfluous. Similarly with the J&J, With the current rate, only doing that, another 150,000 doses will be superfluous. But we knew we had to move to another plane to protect our population. International developments with the Omicron variant has demonstrated to us that we were on the right path in thinking about this, because this strategic stock build-up started. The negotiations for this would have started a couple months ago. It's not that you make a decision and you're getting 84,000 doses of vaccines in one day. This was careful planning, careful coordination, and that is where we are. So my three messages this morning are: one, regardless of political color, I am asking the UNC and their leadership to please stop shaking the population's faith in our COVID response, to please stop the personal attacks against Dr. Parasram, Dr. Richards, Dr. Trotman, Dr. Avery Hines. These are the same persons who saved Dr. Gopi Singh's life. It is not useful, it is not helpful. I have indicated where we are with a booster program. Now that vaccine inequity is no longer an issue. And three, that the RHAs have been instructed to speed up the administration of vaccines to those over 60, especially, who receive their Sinopharm shots. So those are my messages for this morning, and I thank you.
And thank you very much, Minister. We now move into the question and answer segment. Our media representatives are asked to state their name and the name of the media house that they represent before posing their questions. Because time is limited, we are requesting a maximum of 2 questions per media house in the first instance, and if possible, we will field an additional question from media representatives once time permits. Our first question comes from CNC3. Good morning.
Hi, morning everyone. Rashad Khan, Guardian Media Limited. Okay, so Minister Diyal Singh, both my questions will be for you this morning. Firstly, on that booster program, since you just spoke about it, if I'm recalling correctly, the guidance that the WHO gave for boosters or a third primary dose was for healthcare workers, elderly, and immunocompromised. So I'm not sure if there was another one for everyone, but if there isn't, what prompted that divergence from the WHO criteria, which we've been so heavily reliant on up until this point? And my second question is, when it comes to COVID-19 testing, right? Testing is one of the foundational pillars of this pandemic. Can we see any tailoring to our testing program that brings in or lessens the turnaround time for persons to get their results, probably through rapid testing? And what is that current turnaround time? I believe it's a matter of a few days.
Thank you. So those are very good questions. As I indicated, WHO had initially based their proposals on the issue of vaccine inequity. You would recall when the United States first announced their booster program, WHO was advising, look, if people and adults in other countries can't even get their first dose, why is the United States giving a third dose? That was the vaccine inequity theory or position on which WHO built its platform. As I said, now that in Trinidad and Tobago and in many countries, vaccine inequity is no longer an issue which the position was built upon, we now need to look at expanding the access of vaccines via a booster program. On the issue of testing, testing continues to be robust in Trinidad and Tobago. Our turnaround time for PCR is a matter of a couple of days. Our turnaround time for Gene Expert is a couple of hours. We are already employing our rapid antigen tests. To date, we have done, and I'm glad you asked it, because this is something else that is totally misunderstood by one person in particular. In Trinidad and Tobago, we have done 140,000 rapid antigen tests in Trinidad and Tobago. That gives you results in minutes. So we have 3 layers of testing. Rapid antigen, results in minutes. And the technicians will tell you which ones have to be confirmed by a PCR, but in a matter of minutes. 2, gene expert in a matter of hours. And 3, high volume but slightly lower turnover PCR in a matter of hours, but to report it over a 48 to maybe 72-hour period. And those are the gold standards around the world. Richard, I want you to remember, this is around the world. I think sometimes we tend to think that COVID is only in Trinidad and Tobago, and only Trinidad and Tobago has challenges. But we have done so well, and I don't think the professionals get the credit they deserve for mounting this response to COVID-19, which has saved lives. Right? Thank you very much for the questions, Richard.
Thank you, Minister. We now go to Power 102 Digital. Good morning.
Good morning, Sparkle McIntosh, Power 102 Digital. Both my questions are for Minister Singh. My first question has 2 parts. Minister, the WHO has warned countries against instituting a travel ban, which they say attacks global solidarity, and instead urge them to follow scientific approach because research into this new variant is still ongoing. Given the ministry's tagline in the past of following the science and that its decisions will be based on WHO policy, and although we know that a travel ban was implemented by the Ministry of National Security, what accounts for this deviation this time around in following WHO advice and instead acting as countries such as the US and the UK after being hesitant to do so in the past? B, what is the process or science behind coming to such a decision of when to follow the WHO and when to follow the US, or is this just a knee-jerk reaction? My second question, our newsroom has been made aware of several instances in which persons self-medicating with ivermectin, which they're accessing at pharmacies, are having adverse reactions. Can you comment on this issue? Thank you.
Thank you. So, Sparkle, you may remember that our very first action and I'm glad you asked the question. I'm so happy that you asked the question about whether we are deviating from WHO or not. International health regulations that you are speaking about, which talks about bans. Trinidad and Tobago was one of the first countries last year to institute a travel ban on China. And we were criticized for it, because at that time, international health regulations with WHO didn't say that. You must recall that international health regulations as put down by WHO are not legally binding on its member states. They are optional. So in the same way we instituted travel bans, we were one of the first countries in the world to institute a travel ban in China early last year. There's ample precedent for what we are doing today, so we are not blindly following the United States as you indicated. What is the science behind instituting a travel ban? Simple. It gives you an opportunity to slow the spread of the virus so that your country can prepare. That is what all countries who have decided to institute some sort of travel restrictions are doing. If we don't learn from the past experiences of Delta and so on, we would have failed as public health policymakers. So the science behind a travel restriction is to slow the spread of Omicron, in this instance, as we did last year, to slow the spread of the initial Wuhan strain. So there's ample precedent for Trinidad and Tobago taking this step. We followed no one blindly. On the issue of ivermectin, I have spoken publicly, others have spoken publicly that ivermectin is not to be used as a home remedy for COVID-19. We urge the public and those who are recommending ivermectin that this is not a recognized therapy anywhere in the world for COVID-19. As Dr. Richards will continually tell you, some of these patients trying to self-medicate at home, they refuse the chance to come into our hospitals. The ambulance has to go by them 2 and 3 times, which ties up the ambulance system. And by the time they arrive at our doors, they are so severely ill, and that is contributing to this current wave of deaths, as sad as it is. And this is not only in Trinidad and Tobago. My colleague from Barbados spoke about this 2 weeks ago. It was carried on page 20 in the Express, that Barbados is seeing a similar phenomena. So we are part of this regional and global place now where people feel they could ride this virus out at home. You can't. Come in early, get treated early so you don't get into an ICU, so you can return to your families and spend a good Christmas with them. Thank you very much, Sparkle.
Thank you, Minister. We welcome AZP New to pose your 2 questions now.
Good morning, Private Harry, AZPnews.com. Good morning to all. My 2 questions are for Minister Dialsingh. Minister, you spoke about a bipartisan approach, to the whole fight against COVID-19. The MP for Myro, Mr. Rushton Parry, he has posted on his Facebook page, AZP News, they carry a story, that he has the blueprint in the fight against COVID. I don't know if you want to speak to him. Would you be willing to speak to him, concerning that? He speaks about collaboration with the RHAs, with the police, etc. So, I don't know if that is something you'd consider. One. My second question is, I know a number of the AstraZeneca vaccines are about to expire tomorrow. Can you say how many of them, and how would that affect people who had 1 shot of the AstraZeneca? I know they can get, a Pfizer now. Can you say how many of those people, would be in that position? And also, we have been told that the number of the Pfizer vaccines had to be disposed of. Is that true? Can you tell us why that was done and how many? Thank you very much.
So, let me deal with the rumor first. Prior, I don't know where you got the rumor that Pfizer vaccines had to be disposed of. I really don't know. Please, oh gosh. No Pfizer vaccines have had to be disposed. On the issue of AstraZeneca, 1st shot and 2nd shot, we are one of the countries that took a decision very early that we would ring-fence 2nd doses for persons who received their vaccine, so you could get like for like. And that is why we stopped issuing 1st doses of AstraZeneca 2 months ago, knowing the expiry date and knowing that we want to give persons like for like. The only adjustment to that is for persons under the current additional dose regime. If you are due for a 3rd shot of AstraZeneca and that expires tomorrow, you can then access the Pfizer vaccine. We have said that very many times. The issue of AstraZeneca vaccines has to be taken separately from the other vaccines. You may recall, we said very early, we were pleasantly, and it was first reported in the United States last year when they started some AstraZeneca, or in Europe, I believe. And we had the same phenomena here, that you were getting sometimes 1 and 2 doses more out of the AstraZeneca vials. Remember that? So the remaining AstraZeneca, which is about 3,000 to 4,000, is not really those doses which were committed. those are really those doses which are the overages that you will be having now. So no doses are going to be wasted that we were committed to. There may be some doses, because of that overage position, that may not be used by tomorrow, and that is going to be minimal. On the issue of MP Mayara with the blueprint on Facebook, if he sends that blueprint to the Ministry of Health, we are willing to engage with anybody who has the best interests of Trinidad and Tobago at heart. He may have useful suggestions, but what I will advise him to do is to send it to me. He knows my number. He doesn't have to post it on a Facebook page. He can send it to me, and once there's something useful in this national fight, it will be looked at. We refuse no good advice. Thank you very much.
Thank you very much, Minister. Media representatives, you are reminded 2 questions per media house, and also CEO Thomas is here and available to address any questions relating to NCRHA that you may wish to pose to him. We go to Express for your questions. Good morning.
Good morning, everyone. Leah Soares from the Express newspapers. My first question is for Dr. Abdulrichards. Are you able to give us a breakdown of the number of COVID ICU beds in each of the hospitals in the system and the number of critically patients currently in each? And my second question is for Minister Singh. How are we doing in terms of the vaccination of children 12 to 18 years? How many have been vaccinated to date? Thank you so much.
Thank you very much for your question. I'll start by indicating that the ICU bed capacity is dictated by supply, demand, and the availability of resources, and it is a dynamic situation that changes on a day-to-day basis. That is, we can upscale an HDU level bed to an ICU level bed, and vice versa. So we try to allocate resources from human resources and equipment, oxygen capacity, and many other factors to ensure that the patient receives all that they require, while at the same time not expending resources where they may not be needed on that particular day. So I'd just like to indicate the number of beds that we have available. In the accident and emergency departments, as part of the Delta preparedness, which the Honourable Minister spoke about in July, August of this year, when we saw a bit of a lull in cases and we started to plateau, we were advised to build capacity. And when we started noting that there was an increasing number of severely and critically ill patients, and the current system involves the patients coming to the accident and emergency first for stabilization, we built capacity at the traditional accident and emergency departments in Trinidad and in Tobago. So at present, the ICU capacity to treat confirmed COVID positive cases across the A&Es in Trinidad is 27 beds. Patients are treated, they receive ventilation, they are treated and managed by the ICU teams at the hospitals in line with the same protocols and guidelines that have been developed for the parallel healthcare system. So it's a continuity of care approach. In Tobago, 2 additional beds were added in what are called biocontainment or isolation units. So in all, there are 29 beds that are available in the accident and emergency departments. I'd like to now discuss the hospitals in the parallel healthcare system. And in Trinidad and Tobago, at present, there are approximately, I would say, 72 ICU beds that can be operationalized. Now, we do add the demand, and based on the demand, upscale beds. So some beds are actually HDU level, but can, as a contingency, be upscaled to an ICU level bed. Of course, that would be a kind of last resort at this point. So at the Cuba Medical and Multi-Training Facility, the initial capacity was 22, but contingent on staffing and contingent of available resources, we have in emergency cases been able to upscale to 28. And I want to commend Mr. Thomas and his team for ensuring that happened last week when we had an extremely high demand to ensure that all our patients receive good care. At the Arima General Hospital, right now there are 16 beds. We gradually have been increasing by 1 to 2 beds, and on the weekend we added an additional bed. So we went up to 16 ICU level beds. Of course, all these 16 beds were filled on the given day. At the Augustus Long Hospital, again, we increased by 1 bed over the weekend, so we've gone to 12 ICU beds. At the St. James Medical Complex, we are at 6 beds with plans to increase, and at the Point Fortin Hospital, we are on 6 beds. There are 4 HDU level beds at the Cora Hospital, and we again are trying to upscale that capacity, and of course, Dr. Trotman is managing that process. In Tobago at present, there are 5 core parallel healthcare system beds. They, as I said, increased gradually by 2 to deal with the increased demands, and there were an additional 2 beds in the biocontainment unit. So just to let you know the status, the number of persons at our hospitals this morning in Tobago, as I indicated, 4 ICU patients receiving care. In their parallel healthcare system, at the Couva Medical and Multi-Training Facility, there are 20 patients this morning. At the Augustus Long Hospital, 12. The Arima General Hospital, 15. St. James Medical Complex, there are 4 patients, and Point Fortin, 6 patients. We continue to do all that we can, but human resources especially are limited. And we appeal to the population. The only way that we could continue to maintain both our traditional and parallel healthcare systems would be through vaccination. Thank you.
Thank you. So let me answer the question that was asked about vaccination rates for our children 12 to 18. So in Trinidad and Tobago, we are only at this time vaccinating persons, children 12 to 18. 54,040 have received their first dose, which is about 60% of that 90,000 that the school population talks about. And 48,550, or 53% of that 12 to 18 cohort, have received their second dose. Of concern is the pregnant population. To date, only 933 persons under 1,000 have seen it fit to access a first shot, and 586 have accessed a second shot. We are all concerned about that pregnant population, and we don't want to see more pregnant women dying of COVID. It is heartbreaking. It is absolutely heartbreaking, and Dr. Abdulrichards could talk to that a little further. But remember, the public healthcare system, we see about 93% of the pregnant women in Trinidad and Tobago. And we talk to them in our antenatal clinics. We give them the information. We give them the advice. We plead with them. And I continue to make that plea this morning for our pregnant population. Once you qualify to receive the Pfizer vaccine, get it. We don't want to see you being an ICU statistic or a fatality statistic. So thanks for asking the question.
Thank you very much, Minister. We quickly go to Newsday for your 2 questions.
Good morning. Hi, good morning, everyone. Brianna McKenzie from Newsday. My first question is for Dr. Abdulrichards. The minister mentioned comments by Dr. Tim Gopi Singh. One of the things he said on Sunday was that there may be an oxygen problem at the Point Fortin Hospital. I'm not sure if you can speak to that.
Could you just speak a little louder? We're having some challenges hearing you. Could you repeat your question, please?
Okay. Good morning again, Rihanna McKenzie from Newsday. My first question is for Dr. Abdulrichards. The minister mentioned comments by Dr. Tim Gopi Singh, and one of the things he said is that there may be a problem with the oxygen at Point Fortin Hospital. Can you speak to that?
Yeah, sure. So again, it is amazing how Dr. Gopi Singh inflames the public's perception of the parallel healthcare system. I was on one of the radio stations last week speaking about this issue. Yes, there was an issue, and they had to temporarily convert the delivery of oxygen from piped oxygen to tank oxygen, and no patient care was compromised. We are in a pandemic. These are mechanical things that will go wrong from time to time under load. We have our emergency response teams, as CEO Davlin Thomas said, across the RHAs, they have their IR teams, incident response teams. And the incident response team responded, and whilst they settled the issue of pipe oxygen, they simply converted to tank oxygen. There was no crisis, no patient care was compromised. And you know what? Dr. Gopi Singh knows that. But just to create doubt, instead of working with us, that becomes the national narrative. And I spoke to this issue last week on radio, even before Dr. Gopi Singh raised it yesterday. Thank you very much for raising it again.
Thank you, Minister. CL Communications, we're ready for your 2 questions.
Good morning, Natalie Singh, Caribbean Lifestyle Communications. My 2 questions, one is for Mr. Dayal Singh and the other one is for Mr. Thomas. The first one is, on Saturday, one of the things that was said was that Omicron makes the COVID-19 response more complex in Trinidad. I was just wondering in what way. And then my second question is to Mr. Thomas. Are you satisfied with the vaccine uptake at the under the regions which the NCRHA covers? Thank you.
Thank you. So yes, so Omicron or any variant is going to make your response more complex, because why? It adds another degree of uncertainty. It adds another degree of response. So we will now have to respond at the surveillance level at the University of the West Indies for now looking for Omicron. So that is another layer of complexity. So we have to surveil, we have to test, we have to screen. 2, we have to do scenario planning, because right now, and the jury is out on what Omicron will do as far as the severity of illness, what will be the new signs and symptoms. The other layer of complexity is that the scientists are still debating, because it's early days, whether the current vaccines are going to be as effective against Omicron as they are against Delta. So those are 3 main areas of complexity that any new variant will add to your response, and you have to be prepared for that. One of the things we did in responding to that, knowing that new variants will come out because the world is only 40% vaccinated, which is low at a global level. So at that global level where you are only 40% vaccinated, and we discussed this on Saturday, low vaccination rates, which will breed more transmission, will breed more replication in the virus, will breed more changes and mutations and errors in replication. So you know that is going to happen. So one of the things we did, as I said earlier, is to build up the strategic stock of vaccines that we are now going to, in the coming, hopefully, week or 2 weeks for the maximum, start to, and I'm starting the discussion this morning about the booster program. We have to learn how to respond quickly and with some degree of agility. So that is how it complicates and makes the response more complex. Davlin.
Mr. Thomas?
Well, to answer the question in one short word, it's no, we're not satisfied, but we are optimistic. Anecdotally, we're hearing from the primary care nurses that are vaccinating currently that the vaccine complacent are quickly becoming vaxxers or vaccinated. And that is really a trend that we want to see continue. But certainly not, but the trend seemingly is that the complacent vaccine, those vaccine complacent persons are now becoming vaxxers or vaccinated.
Thank you very much, Mr. Thomas. Our final questions goes to TTT. You're ready for your questions. TTT, good
Hello,
morning.
morning, everyone. Hi, morning, everyone. Kimberly D'Souza, TTT News. Quick question to Minister. Minister, Trinidad has been granted a few venues for the upcoming Under-19 Cricket World Cup, which begins in January. Do you know if the ministry will consider these venues to be dedicated safe zones? Thank you.
Thank you. So that is early days for me. We will be in talks with the Ministry of Sport, also in talks with Cricket West Indies, but a safe zone as determined by the current regulations. I think we are expanding the term safe zone outside of the current realm. Applies to restaurants, bars, casinos, gaming houses, and so on. So we are open to discussions with our partners, and we will see how that goes.
Thank you, Minister, but we want to stay with you for closing remarks.
Yes, thank you very much. So thank you very much again, ladies and gentlemen, for coming out to another one of these press conferences and for carrying the messages. As I leave, I just want to alert the population to remind of part of my opening statement. Now is not a time for fear or panic, but it is a time to be vigilant. I think vigilance is the way going forward. Take all necessary precautions to protect yourself, your loved ones, especially in this Christmas season. Gather and socialize carefully, hopefully with vaccinated people as far as possible. Do your Christmas liming, distance, and let's try and come through this challenging period, which is challenging the world. With Omicron, a lot of the verdict is still out as to how transmissible it is, what constellation of signs and symptoms. But let us take advantage of the current vaccination program. This is a good way to protect you right now from what we have circulated in Trinidad and Tobago. Thank you very much, Al, and thank you to ladies and gentlemen of the media.
Thank you very much, Minister, and our presenters. Thank you, Trinidad and Tobago, and goodbye for now.
I solemnly pledge to dedicate my life to the service